I'm Philip Louis Marjon. I'm a hematologist oncologist out here in San Marcos, California, Southern California, very close to San Diego. And I've been practicing for about 20 years now. Things that led to my career in oncology include personal family members being affected by cancer. As we know, 1 in 3 people are affected by cancer, so it's very likely that many people have a personal experience. In addition to just high interest in science, in cancer, molecular biology, and I get a personal satisfaction in helping people. So all of these things come together to lead to my choices, ultimately of becoming a hematologist oncologist helping cancer patients. When a new patient comes to see me, I very much pride myself in trying to review as much of their information before they come in. Or when they come in, I present as much as I know to them in the dialogue, in time, and they begin to realize that I do know a lot about their case, and they begin to feel confident because of that. Most cases that really establishes some element of trust. Of course, they know we don't know everything. Many times we still have to staging, and other characteristics to the cancer needs to be investigated. But when they see my passion and the fact that I'm already trying my best to learn about their case and expedite their workup and diagnosis, they usually realize that I'm a very motivated person. They're pretty happy to have me working behind them. There's a lot of advancements in cancer, and this is a revolution happening in medicine right now. And specifically for melanoma, there is an amazing field because there's types of treatments which are very targeted, molecular targets that are now approached with oral therapies, in many cases, which are highly effective even for very advanced stages of cancer. In other cases, we find utility for immunotherapy. And there's many different types of avenues now offered for immunotherapy. Over the last 10 years, the list of therapies that are considered immunotherapy continues to grow. And then there's engineered therapies, such as chimeric antigen receptor T-cell therapies, which are now also offered for melanoma patients. So melanoma used to be a devastating field, but it's quickly demonstrating that it's one of the most viable fields for new technologies to find their way into the clinic. Some reasons that patients would choose C-Care, because C-Care is in the community, but it's providing not only a standard of care, but I think an excellent standard of care with amenities such as clinical trials that are available to patients. So I think the facilities are excellent. They're well established. These clinics have been built up slowly. The doctors have been here, some of them over 2 decades, developing their relationships with the PCPs around here and other specialists. We have good relationships with the local hospitals. So for instance, if someone gets sick, not only would I see them here, I would see them in their local hospital. But if need be, I can also provide the latest clinical trials for some of our patients as well. And I really love being able to provide community care, great community care, but also providing the most modern of clinical trials for our patients. People frequently remind me that oncology is a tough practice, but I am very much motivated to actually help all patients despite whatever's against them, whether they have stage 4 disease or even if it's a very early stage disease. I love providing options for patients, giving them avenues to fight back and giving them comfort. And we all know that we don't have crystal balls. We don't know what will come in 10 or 100 years, but helping each other is a very purposeful existence. And I love this job for that.